Good evening, everyone. Welcome to our SaaS Rehab podcast series, episode 3. I am Dr. Pratibha from SaaS Foundation and we have Dr. Bose with us. So, today we are about to discuss a very core area of SaaS Foundation, that is wellness. So, sir, exactly what is wellness?
Pratibha, wellness is a very important area in today's post-COVID scenario, and we are all to a certain extent we are ill in the sense that we have a lot of issues. We may be thinking too much. We may be anxious. We may be depressed. There may be a lot of other issues. You may be sick. You may not be intellectually happy. You may not be emotionally happy. You may not be financially happy. So everybody goes through a process called illness. And your mind is always full with a lot of negative things. So illness is a very common thing in today's scenario. So wellness is basically how you can move from illness to wellness, from how you can, change the letter I to V. And though it's not very simple, so there you have to really understand, what exactly the person is going through. So it's basically what we are talking about. Wellness is a holistic harmony where you have to really connect the person to help him or her to reach certain hormones so that he feels good. Even if he is in an adverse situation, he can cope it better, he can handle the situation better, he can see the bigger picture. So basically, the whole concept of wellness program, what we run in SaaS or what we are doing with our other activities, is basically to create a holistic harmony in the mind, so mind body works in harmony.
So, what do you mean by the term illness? It is related to some disease, or you have some other perception related to it?
Illness could be because of a disease. You may have some basic disease like morbidity. You may have certain disease. Illness is basically how you perceive your problems.
Okay.
You can perceive your disease very seriously, or you can take it very positive angle and take care of your other variable factors. And you may not be diseased. Maybe you're a little anxious. You may be a little hyperventilating. Maybe you're thinking that COVID is back. Probably I can hit hard again. So it's all about how you take it. Illness is a kind of a coping. How to handle the situation in different scenarios. Whether it's a disease, whether it's a state of mind, whether it's a situation. So to a certain extent, we are all ill. But there is an intensity of illness varies from people. Some people may have small problems, but they can be very seriously. Some people may have large problems. They may have lung issues. They may have oxygenation issues. They may have other issues. But they can be, from illness point of view, they may be much better because they are probably learned to handle it. They have accepted the situations and probably they are using their coping and the disease modifying strategies more effectively. So illness is not directly proportional with your intensity of health hazards or your sickness or disease or morbidity. It is how you perceive it.
So friends, illness is not just related to your existing disease or any comorbidity. It is related to you, how you perceive the things, how you perceive your situations, and how well you cope with your existing situations. So we got to know that SaaS Foundation is doing a very prestigious project with Delhi University and Ministry of Health. So, can you tell us more about that project?
Pratibha, when in the COVID time, when we see that, all permutation or combination of patients who are coming, some people have very mild COVID, but taking it very seriously, some with a serious problem, taking it more positively. I told you, the intensity of perception can vary from individual to individual. Then we thought that probably being healthy is not enough. So, you have to go beyond health because the mind plays a very important role. And mind is not something like about your mental health. It is a combination of your mental health, your emotional health, your intellectual health, your financial health, your environmental health, your social health, how you're connected to the cosmic world, your cosmic health. There are so many other factors, So we thought probably why not we create a personalized questionnaire so that we understand a human being better. So we design a questionnaire called Wellness Questionnaire, which comprises of very exhaustive questionnaires based on scoring system. How would you feel? Are you bothered by others or not? Whether you get those anxiety symptoms or not? What's your how good you eat? How good you sleep? What kind of snacking behavior you have got? Do you get bothered by others or not? Mental and emotional health questions very specifically. But every component we have got specific questions. Even in the physical health, we are talking about your nutritional health. your your workout health. So we have designed a very exhaustive questionnaire, what we call in the form of a Google questionnaire format, and this is a very ambitious project which SAS is doing with Delhi University, Ramjas College, and Ministry of Health and Family Welfare. So already we have registered more than 1,000 people, and we have a Google questionnaire. People can access to it. They can go through the link and go through a Google questionnaire. You need not have to be sick or bodily disease or with serious episodes. A person, in the COVID time when they could not read much, probably they could not cope up with an online, getting used to the new kind of concepts. So people have developed a lot of problems, and I always tell people that when you go back to your situations, when you stay in the past, or you carry you piggyback things, you carry your past with today, so you carry a lot of depressions, and that's why I find a lot of antidepressants being used in plenty in the society. And when you think too much about future, which you don't know what will happen, and thinking that probably COVID will come back, there will be more unemployment and there will be more disasters. So staying in future and staying in the past is a sign of a very poor mental health. So wellness questionnaire is basically to understand how good you stay in the moment, how's your adversity questions, what are the different components, how good you connect all these components, and which is your weak area. So through the questionnaire, we can know whether he needs a mental health counseling, whether he needs an emotional health counseling, whether he needs an intellectual, whether he needs a social health counseling or an environmental health counseling, because all these factors are very important. So even people are working in the work from home, that the space from where he's working, that also can play a very important role in your how you cope up and how you feel good. So it's a very interesting and very holistic way of understanding health, and anybody can be a part of this wellness project. So I'll request people, anybody who is not feeling good, who has got sleeplessness, those who have got little low feeling, not able to perform well, feeling exhausted, not motivated enough, on not doing enough of activities, nutritionally not good, have some family issues, you're not very happy about your environment, or finding difficult to cope up with your studies, or whatever, in any form which makes you feel a little low, you're most welcome to come to us and join our, this wellness questionnaire, which is available. I think Pratibha, you can explain where is the questionnaire available.
Yeah, so we'll mention the link of the questionnaire in the description box, so it will become easier for everyone to access. So friends, in nutshell, what I got through Dr. Bose's conclusion is that this wellness questionnaire is for everybody.
Absolutely, it's for anybody and everybody and all age groups. They can access this questionnaire, and they can write to us, and we will love to counsel them. And let me also tell you, once we collect the data, so we basically divide the cohorts into two groups. One is that people with absolutely healthy body but they have a poor mental health. The second is that poor mental health and a poor body.
Okay.
So when you have a poor body and poor mental health, that means we're talk of the disease. So we are here with that. That is what we call, we give a very personalized way of doing it. We have very structured way of handling. That's why it's very personalized way. It's not one suit doesn't fit all. So it's very tailor-made. So and I can give you a simple example. Suppose you don't have any disease. You're a young person. You're finding difficult to cope up with your studies. There has been a gap in the COVID time. There has been financial struggles and workload, family pressures, not feeling good, and a lot of things to do. You're not sure what to do next level. So you need a philosophical counseling. So we have philosophical counselor. Basically, the project what we call is called SAS. It is a systematic awareness and analysis of neuro-philosophical counseling. Basically, we are using a very interdisciplinary method of reaching out to the people. Yeah. It's not only a medical approach, it is a combination of medical approach, the philosophical counseling. I'm not talking the psychological counseling, the philosophically we are connecting it. It's basically a project between SAS and the Department of Philosophy of Ramjas College. The philosophers are connected with us, and also we have got other people like psychologists and therapists and doctors and psychologists all working together, and nutritionists. But basically we are using philosophical techniques as a method of helping these people, and it's very interesting and it's very tailor-made.
Okay, so I think I would like to know more about this, like what will be the components of this program, this wellness program?
Look, for example, one is that we are doing from the academic point of view, the research point of view, what we we classify different cohorts.
Okay.
So that is more of a research base, so that we can help the next level. What is the next level of doing it? Like for example, based on this observation, we can do some scientific studies. We can do neuroimaging studies, so that we can understand what is the future of the what will the future scenario of health. So health is not simply an absence of disease or your being fit. It is much beyond. It is a combination of so many factors. So wellness is the new mantra. So you have to. Wellness is a real term where you stay happy, you stay there, and whatever the situation, even if you are not happy with your surroundings, but you still feel happy. So it's a kind of an harmony. You accept things in a very holistic manner. It's basically treating the body as a whole, WHO, not simply as a whole in the body. You're not attacking one component. You're connecting all the components in a very holistic manner, and that's why it is very interdisciplinary. It has got different components, as I told you. It has got nutritional components. It has got yogic component. It has got philosophical component. It has got psychological component. It has got therapeutic component. It has got the therapist also scaling the people how to cope up with different situations. So it has got different structured program. But when we talk of really and organize a sample program, so first and foremost thing is that suppose one aspect, as I told you, is the research aspect, the academic aspect, that is a different. But somebody wants to have this wellness program. So we have a ready-made questionnaire. They can go through the questionnaire. If we find the questionnaire, we have got different levels: mild, moderate, and severe. If your score is moderate to severe, then probably you need our help. So what we call you, you can through video chat also you can get back to us through WhatsApp and video chat, preferably with those physiological, physical counseling is the most important. And Pratibha, you're the right person. You can always share your number and the link so that they can reach you directly.
Definitely.
So, and once we are done with once we classify the degree of your stress level and also your comorbidity and other variables, maybe you are into alcohol, the drug, the smoking, the situation, so many things we find out. So we give a very structure-made program. So the most important, the entry point is that we do a systematic way of understanding the person. Then depending upon, suppose we have a mental health problem, then probably we have to talk about his personality, communication. So there probably cognitive behavioral therapy plays a very important role, where you connect him with his core issues and all. This is called CBT. If the emotional health is a problem, then it is an entirely different area of the brain, what you call the hippocampal area. It's much different areas of the brain. So where we talk about rational emotive behavioral therapy, then they need a different kind of understanding. We make them much more rational. So when it comes to social health, when you're finding difficult to connect yourself and the people around you, probably we are talking about the logical behavioral therapy, LBT. These are all physiological techniques, but it's a combination of physiological techniques and therapeutic techniques and physiotherapeutic techniques using different gadgets. And breath plays a very important role here. Since as a pulmonologist, we try to connect your mind and body through breath work. So breath work plays a very important role, where we talk about what are the types of breath you can practice to reduce your anxiety and emotion, because basically individuals are two types: either you are hyperactive, what you call sympathetic, or you're a little low and chilled out one, the parasympathetic. So basically we help you to create the balance between two, not too low or not too high. That is what we call the middle one. Breath plays a very important role to move you from mindful to mindful. So breath plays a very important role, nutrition plays a very important role, structure physical methods very important role, certain cleansing techniques play an important role, counseling techniques, psychological techniques. It's a very tailor-made program.
Okay. So I think wellness should be the new mantra. Wellness should be the core area where to the modern problems. For example, post-COVID, many new problems are coming up. People are becoming more aware of their mental issues, social issues, and other things. So I think this wellness program covers everything, and every person, even the normal person, the school goer, old age, everyone can incorporate and enroll themselves for this wellness program.
Absolutely, Pratibha. This is wellness for everybody. It is for professional. It is for teachers. It is for students. It is for everybody. It's for old people, young, middle age. And I'm telling you, one section it needs maximum is the perimenopausal women, those who are entering the menopausal change, because already they have a lot of responsibilities. Maybe they are working at the same time. The hormonal load plays a very important role. So already we are running a series on women health through our Love You Zindegi program. But women is a very important area we have been working on. So anybody and everybody should be benefited by this wellness program. It's a very interactive, one-to-one based holistic, modular, structured, personalized program. And you know, the results which we are getting, Pratibha, in the last 2 years in the post-COVID scenario is amazing. People with a very sick body, with low oxygenation, difficult lung status, through pulmonary rehabilitation and wellness program, they are doing amazingly well.
Yeah.
And we are getting so many people coming to us. I think it's for all. Only thing is that, you know, you have to know what suits you the best. It's basically we help you to connect. It's something like a coach. We are, as a coach, we guide you, we connect you different techniques. And the most important part of the wellness program what we run at SANS is that it is non-pharmacological.
Yes.
We go beyond molecules. It's not we drug you, we don't give you antidepressants, we don't give you anti-anxiolytics, anti-anxiety drugs. We just skill you. We go beyond molecules, which is absolutely non-pharmacological.
I think skilling is the future. Everybody, every brain needs skilling. So
absolutely, Pratibha, this is the new era, and what I call the neuroplasticity is a new buzzword. So we have to rewire our mind and the new neural circuit so that we can accept the new standards. The post-COVID is a new planet, new standard, new rules. You have to develop certain adversity questions, your coping strategies. You have to skill yourself. Your muscle needs more happiness score. You need to work hard and you have to do extra. And how you can do it with the limitation, that is the way to go. So neuroplasticity is that you rewire your brain so that you becomes a new man. It's possible.
Yeah. So even if we go back to the evolution time, even Darwin also quote this example that survival of the fittest. That means one who can adapt to any situation, cope up with any existing situation is the one who is called fittest.
Absolutely, Pratibha. This is what, you know, I always say that initially there used to be say that intelligent quotient used to be the buzzword, but that has been gone absolutely in disrepute. Then they say that the corporate hunkus and leaders, they should have the EQ, emotional quotient. We found in COVID time even the corporates could not handle those emotional quotient well. Even the best corporate leaders, they collapse like a parrot caught. And now we call it the most important thing is the what you call the adversity questions. How you can, you know, adapt yourself to different adversities.
Definitely.
You know, in difficult situation, when you have limited resources, when you have everything is, you know, scarcity, how you can excel in adverse situation, and that is the way to go for it, and that is the way to go for a total wellness, or what you call a holistic harmony.
So I think holistic harmony is everything in existing situation, in upcoming times, and it is need of the hour as well.
Absolutely, it's the need of the hour. So friends, stay connected. If you have any queries, go to our comment box, write to us, we'll get back to you. We are very excited to know you more, and stay connected. Take care. Regards, Dr. Bose.
Thank you so much. Thank you. Good evening.